So my name is Leah Lujan. I'm a member of the Choctaw Nation and also an ICWA consultant with Central California Training Academy. And I'm also had the pleasure of being part of the statewide convening planning team. I have the pleasure of introducing our next panel and transitioning. This courageous panel is entitled Rooted in Community: Parents Leading Trust and Protection for Children. Our panelists have been working diligently to bring about thoughtful and relevant insight, along with heartfelt comments that really are here to help all of us have, to help everyone have a hope of assisting county prevention teams with more effective and authentic lived expert engagement. And now I'd also like to introduce my colleague, Andrea Lewis. Can we have the next panel, next slide, please? Thank you. So Andrea Lewis is the Linkages Senior Project Associate for CFPIC. This is a statewide organization that advances the implementation of sound policy. Andrea had experience on both sides of the desk working for Riverside County for many years. Excuse me. She is committed to supporting the collaboration with CalWORKS and the child welfare system to facilitate and streamline early intervention and collaboration. And just getting to know Andrea, she is just a pleasure to work with, but she is an absolute advocate. So I would like to go ahead. I'm excited to hear from the panelists. Please, Andrea.
Thank you, Leah. Good morning, everyone, and thank you for joining us for this important panel, Rooted in Community, Parents Leading Trust and Protection for Children. Today, our goal is to explore prevention strategies from multiple angles, highlighting how collaboration can drive meaningful transformation in our communities. I will guide our discussion by posing questions to each of our panelists, but please feel free to build on each other's insights and engage in a respectful, dynamic conversation throughout the session. We aim to keep our discussion interactive and inclusive. I encourage all panelists to share concise responses, allowing everyone the opportunity to contribute their expertise and perspectives. And now I'd like to introduce you to our panel. Tencha. Tencha Chavez is currently in graduate school at the University of Southern California in a dual degree program, Master of Public Administration and Master of Urban Planning, with a concentration in arts and culture. Previously, she worked for the California Native Vote Project as their strategic initiative outreach manager. She was born to the Meadow people and born for the Mexican people, Chicana. This is how she is Diné, Navajo. Her homeland is on the Little Water Reservation within the Navajo Nation in New Mexico, but she was born and raised in Los Angeles County, where she's lived her entire life. Tavia. Tavia Wooley is a visionary leader, storyteller, and change maker, committed to building systems of equity, creativity, and belonging through community collaboration. She is the founder and executive director of Empower Them Collective, a systems change organization established in 2021 to address root causes of inequities such as systemic racism, economic injustice, and maternal health disparities across Los Angeles County. Under Tavia's leadership, Empower Them Collective has become a driving force for community transformation through its 5 pillars: policy, economic empowerment, advocacy, research, and leadership. Pearl. Empowering women, families, and youth to create sustainable change. Her own personal child loss helped to fuel her work in the African American Infant and Maternal Mortality Prevention Initiative in the Antelope Valley. She's recently launched the 661 Creator Space, a Black centering collaborative studio and cultural hub in the Antelope Valley. And Tiffany. Tiffany Dixon is Cherokee Seminole. Oh, I'm going to mess this up. I don't know why. Seminole, Mohawk, and Creek. She is a single mother of three children, two boys and one girl, with lived experience. Tiffany is graduating with her AA at Ventura College and will continue to the nursing program. Tiffany and her family are heavily involved with American Indian Education Consortium through the Ventura Unified School District. Her and her family also participate in Owens Valley Career Development Center and Southern California Indian Resource, Inc. Each participant brings a distinct viewpoint. We welcome diverse and even contrasting opinions. It's through the richness of thought that we can uncover the most innovative approaches to prevention. With that foundation, let's begin exploring our first question. What inequities do you see showing up in access to prevention supports, and how should we address them? Tavia, would you share your thoughts on this?
Good morning. It's still morning. Yes, I would love to share my thoughts. Just want to make sure you all can hear me.
Yes, ma'am.
Okay, perfect. Yes, I love talking about this because this is one of the largest challenges I see is we have at times a plethora of services to offer the community in need, but oftentimes those services are underutilized. And so some of the challenges, specifically for the African American community, is a lack of cultural humility from the employees who work for the organization. I think there's a lot of times we're not talking about specific needs that the Black community needs that goes unlooked because it's not as large of a dynamic or as known of a dynamic as, say, being bilingual. So sometimes I like to communicate with organizations that although you are hiring staff who are bilingual because the needs of the community require individuals to speak multiple languages, which is super important. Sometimes, oftentimes, we don't address the anti-Blackness that some communities of color have towards Black community members, and therefore do not do as much of a due diligence to service and outreach to the Black community. In addition, just the other side of the coin I like to share is that a lot of organizations will have cultural humility training, right? But we don't address the root cause of why certain communities have challenges with the Black community. We don't address that a lot of us have been ingrained in training to be hesitant and resistant to the Black community. And sometimes, because of positional authority, just by virtue of working and having a title, that puts us in a power position over community members. And so we are not addressing the power imbalances. So those things prevent the Black community from having the same amount of access to services that at times are actually catered to them, which then therefore has an underutilization of the services, which causes a ripple effect for future programming and services. So I believe until we start to get very honest and transparent and reflective and our partnering brothers and sisters in other communities of the color regarding the anti-Blackness that's ingrained in our behaviors and thought processes. That's our own fault. I'm not saying anyone's necessarily doing it intentionally, but we're not talking about the elephant in the room. And until we do, we're going to continue to see the Black community get underserved and still can see these disparities show up in across the field.
Thank you, Tavia, for that. That's a lot of the conversation that we have in the background, right? African Americans do have a culture that seems to somewhat be ignored. And so I appreciate you highlighting that today. Tiffany, would you like to share your thoughts?
Yes, thank you. I feel that there's a lot of inequities and well, due to lived experiences through CPS, and I feel that they didn't support me in reaching out to OECDC and scared to do extra programs to help me in regaining custody of my children. The only thing I felt that I was supported with is American Indian education, but I feel that that's because the county had no control on not letting my children attend. And I also felt that they were more supportive towards, because my children are half Hispanic and half Native American, they were more supportive towards the Hispanic side, which that's not what I was. And I feel that the county should be more in all cultures. They should know like what programs are out there to help us, because I felt that when I was attending OVCDC, it helped me to realize what emotions I was going through, how to become a better parent. And also to the courts, it seemed like when they were trying to find out if I was Native American or there was a roll number for me, they tried, but they didn't try hard enough. Thank
So
you.
I hear you saying, see you as a whole person and meet you where you are and provide the needs based off of who you are and the needs that you have. I think that's what I heard from you, Tiffany.
Yes, and I felt that doing the programs through our culture, it was more help, like I got more out of it than the programs that the county had provided.
So opening up to other agencies, community-based organizations that could really cater to your cultural needs was very helpful.
Yes, thank you.
Thank you. Tencha, what are your thoughts?
Hi, good morning, everybody. Yeah, this is a really, really, really hot, like a really good question, right? And there's so many inequities when it comes to the Native American community. And not only from lived experience, but from working in social services with, UAII and with, California Native Vote Project, doing political advocacy. There's a really deep disconnection with the Native community. A lot of mistrust from our people because of boarding schools, forced removal. Tiffany touched on the CPS, all that. So there's a lot of deep mistrust with my community. So my community, a lot of people will not go to government services to get the help that they need. So therefore, it's like a never ending like circle, right? We're constantly in and out, in and out, in and out of systems. So that's one thing. And another thing I see is, being on the social services side, is that our community is always the last people to be brought to the table. I can't tell you, like, towards the end of my career at working directly in social services with my community, we were barely being brought to the table on certain issues. Whereas, and it's so great that we see other BIPOC communities heavily into advocating for their communities. But when it came to ours, it's very, and I get it. At USC, I'm learning that it's a touchy subject to deal with Native communities because a lot of people don't want to, kind of like they don't want to be disrespectful. And so it's just bringing us to the table, asking us what we need, but also giving us a fair amount of voice in order to speak what we need for our people. So, like, we need to be able to say, hey, this is what's going on. And Tiffany touched on it. For myself, when I got clean and sober, it took my community to help me, right? I had a deep mistrust for government systems. So when I went to my own community to help me, I surrendered, and here I am 8 years later, right? But those are the different things that I see as inequities not being brought to the table. Lack of funding, so much lack of funding. And for our community, like, you only in LA County, you only have maybe like, I would say three is not, maybe four NGOs or nonprofits that work directly with their community, and we're spread all over the county. So you can imagine there's something in Palmdale that will help the Lancaster, Palmdale, Antelope Valley area. Then you have downtown LA, and that's supposed to like help everybody in that area. And a lot of people don't have transportation to get to these services, so then they just go without it, right? So those are different things that I see.
Thank you, Tencha. And you are on fire this morning. I appreciate all of that
Let's
feedback.
go, let's go. I gotta speak up for my people.
But I will say that I need you to slow down a little bit for the interpreters and for the ASL. So
All right.
we want everyone to be able to hear these words, right? And so I'm
Okay.
just going to ask you to slow down a little bit, but what you just said is super important and it really echoes what I just heard from the other panelists. Meet us where we are, understand our culture and work with us from that point and you'll get way more positive interaction with us. That's how we're going to build trust with you seeing us in our place where we are and being able to meet our needs from that point. So I thank you three ladies for the first question. Moving on to our second question. For our panelists who are a part of the Native American Indian tribe, from your own experience, how could counties approach ICWA, Indian Child and Welfare Act, and the spirit of ICWA in those supports? Tencha?
Okay. I'm gonna have to slow it down because I do talk fast when I'm excited. Um, so for my own experience, okay, so I'm enrolled in my tribe, right? And what happened for me was there was an audit. Long story short, there was an audit within my tribe. So it dropped my quantum down and it made my daughters ineligible for our tribe at that moment, right? So there's a thing called Spirit of Iqua that I had no idea about. And so when we were brought in through San Bernardino County, um, they didn't honor the ICWA. And so we were like backtracked on the side. And then when I had a case in Los Angeles County, the same thing. So what I would say is when it comes to ICWA, please honor the spirit of ICWA. Learn what that means. And because I can imagine like 2 years later, we fixed my quantum and made my daughters eligible to be enrolled. But at that time, everything was already fast forward, fast tracked, and our case ended up the way it did. So I felt alone. I felt not supported. I felt like I was going up against everybody there who was against me. I had no idea what I was doing. It was my first time being in this type of situation. And so I felt really scared. And so when it comes to this, even ICWA or the spirit of ICWA, I believe that all counties, all judges, you go into the court system and you see this sign, right? It's a real little itty bitty sign that you see. And it says, if you are Native American or believe you are, please let the court clerk or somebody there know. It needs to be it needs to be part of a curriculum or it needs to be part of the services right straight out. Hey, if you are Native American or you have Native American descendancy and you're able to prove it, right? Because that will show the spirit of ICWA, then it should be honored, right? So those are my thoughts.
Thank you, Tencha. I hear you. Resources, funding, identification from the start, and placement based off of those needs. So thank you for sharing. Your voice is super powerful. I think I could listen to you talk nonstop. Tiffany, can you share with us?
Yes, I agree with what Tim just said, and also too, I feel that they need to be more supportive of us who are Native American, and also supportive of us going to the resources that the county offers for Native Americans instead of saying, oh, well, even though you're taking that, it doesn't count towards you reuniting with your kids, that they should include that. And then also, too, they should be more appreciative of us who are going out of the box and looking for more help to make us become a better person and encourage us to reach out to other resources through our culture and support us in it, not be against us.
So not just meeting you where you are and your cultural needs, but also assisting you with moving forward to your next steps, whatever those next steps may be for you.
Yes.
Thank you, Tiffany.
Yeah.
For Tavia, we also know African American families are most affected by systems. Thinking about your own experience, how could counties build trust and relationships to engage African American families in supportive services?
Thank you for the question. First off, we're disproportionately represented in a lot of systems, which means, for the amount of Black Americans in the county, we're overly represented in the systems. They're not the same number. Um, One thing I would like to share and really emphasize is that our community, like my brother and sister BIPOC community members, have a long history with these inequities, right? We don't trust the system. We don't trust government entities. And we probably most likely don't trust the extension of that, which is oftentimes a lot of community-based organizations who are contracted by government entities then become an extension of the system and are, a concern for the Black community. You need to, one, acknowledge the harm, not in a tokenized way, not in these statements, but like literally changing how these systems will engage. Like the culture has to change. And I always say when I work with organizations and institutions, there has to be a cultural shift within the organization. I understand that there are deliverables. We have to check the box on, did we do this for the family? Did we check this off? But we need to prioritize building relationships with community and family members so that they know that we are trying to see them as human first and less about the number and the deliverables. So I would say that if organizations, institutions could prioritize building true rapport, which means remove those time limits. I know at the county it used to be like 30 days, 60 days, 90 days that you have to see people and make a decision. In that 90-day period, no one's going to trust you. If you were to come to my house right now, okay, and knocked on my door to ask me about my own family, let me tell you, the door going to get closed, okay? Well, no one is receptive to that, okay? So we have to change the culture and understand that if you want people to be responsive to what you have to offer, assuming you're coming in with good faith, then you have to remove those limitations that these institutions have placed on their workers. So you have to build community and build trust and allow for that to happen. And then you need to just show all your cards. Teach staff, teach everyone that you can't have an agenda. As I mentioned in my previous response, there's a power imbalance. When you show up to work with someone and you have a title and you have a badge and you have some authority over people, or you have the ability to impact the outcome, the consequences, we're already in a power dynamic that is imbalanced, okay? So that would be another thing that we need to look at, is that we need to somehow share power with families and not in a tokenized way. That means that if we are inviting family and community members to have a seat at the table, they have to have just as much power to change the outcomes, to influence what the results will be, just as if someone who is a staff or has a degree or credentials behind their name. So those are my things that I would recommend that institutions and CBOs who are contracted with institutions to work with community members, you need to acknowledge the harm that was done and know that the Black community, okay, you got to come, with some humility. You need to remove those time barriers that don't allow staff to actually engage and build relationships with the families. And then you need to share power with the families so that they truly have a say in what actually happens to them versus this tokenizing approach of we give the appearance that we're going to allow you to have something to say. The families know what they need. What they need y'all to do is to release the resources that supports them getting their needs met. So those are my thoughts.
That was excellent. And as I'm watching the chat, I believe that people are aligned with your thought process. And so I really appreciate you sharing that. Power dynamic is real. Biases are real. And cultural needs are also real. And so we understand that when we come out to someone's house, we are looking at the safety of the children and we have laws to follow. But that doesn't take away from who you are as a person knocking on someone else's door as a person and being able to have that conversation genuinely to say, based on the law, these are the things that I need to do, but based on your choices and your resources and the referrals that are available to you, this is where you can be. And so I hear you building that trust and removing that power is super important. And I appreciate all of your thoughts. Okay, we're going to move on to question 3. How can systems better honor families when they first come into contact? And we'll start with Tencha.
How can systems better honor families when they first come into contact? I believe this will, and I'm not only speaking for, the Native American community, but just for all people in general, BIPOC communities. Tavia touched on it, but understanding that our communities have historical and generational trauma that have been passed down from time memorial, right? Since colonization started, but understanding that and understanding and coming into contact with us and understanding that there are certain needs that each community has and not making us feel like we're a burden, right? Making us feel like, oh, we're asking for too much, or that it's just too much to do, right? If we understood that our communities, have this type of trauma, and we start to address it at the root of it. We talked about this in our meeting last time. We talked about the underlying root to a lot of things, right? And if we peel back the onion layer, it goes way back. And if we start to address those needs from, like children early on, we can start to dismantle all of these things, all of the thoughts, all the things that were taught to us, right? Even though sometimes I didn't directly go through boarding school, but 2 generations ago, my grandfather did, my grandmother did. They were taken away from their families. I grew up hearing stories about people being their classmates being murdered, and all these different things. And there's things that we don't want to talk about, as far as when SA comes involved, physical and emotional abuse. All these things have been passed down. Now we get to the root of it. I believe that we'll start to make changes in all communities.
Thank you, Tencha. I hear you. Holistic approaches, whole family-centered approaches, understanding that we are walking in the door as a person going through the system with trauma and mistrust, feeling burdened, feeling judged, being approached when we ask for services that it's almost like we feel like we're begging to receive different things. And I hear you saying that the door should be open. And so I appreciate you sharing that. And the comments are going crazy. So I think that they appreciated that as well. Um, Not just the boarding schools, right, from 2 generations ago. I think I'm 3 generations away from being my family, my great grandfather being an indentured servant on a slave plantation. We're not so far removed. And then you have all the other laws that came in place, right? The state of California is currently in 2026 attempting and has been for the last maybe 10, 15 years to right some of those wrongs, right? They've been attempting to understand the harm that has been done and trying to make changes to it by maneuvering through the laws. And so I really, really appreciate your sharing there. I am going to ask Tiffany, can you share how can systems better honor families when they first come into contact?
I feel that the systems, they need to know, first of all, what our race is and our religion, and before they address us. Then once they know, they should have resources ready available for us, willing to help us get those resources, not denying us from resources. um there's things in this government that need to be more accessible, because like my children, their dad passed away, so they received SSDI, and there's barely any services out there for me because of what they're getting per month due to their dad passing away, which is not fair to our family, as in what's offered to the government. And They just need to be more supportive towards our culture. I feel that for Native Americans, we're pushed to the side. It's more concentrated on Hispanic and white. Thank you.
And so to basically state this, when you come in for services in eligibility, in order for a worker to make sure that their case is clean so that they don't get dinged, so that they know that they gave you the right amount of benefits, we're kind of taught to look at what could make you ineligible. And we begin to think that way indirectly when we should be thinking, how can I help you to become eligible? What is it that I need to do to help you figure out what this form needs to be? What do I need to do to figure out how can I help you get this piece of paper? But instead, we're on time limits and timelines, and we're worried about our jobs as well. And so instead of thinking of being an ineligibility worker, we need to focus a little bit more on being an eligibility worker. When you look at child welfare, you think their job is to focus on the safety of the children. They really don't care about the parents. They're looking at the story, and my job is to keep this child safe. And mom, you're not keeping this child safe, so I'm going to jump in and I'm going to do that job. And what they need to look at is, how is mom not able to keep her child safe when all mothers, that is their only priority? How can I help this mother to keep her child safe? What is it that I can do to make sure that this mother, this parent, this father has what they need so that they can concentrate on the well being of the children that they have in their home? How can we keep these children in the home and still provide services so that mom and dad can be okay and focus on the children? So that's basically what I'm hearing from you both. And now, Tavia, I'm going to transfer over to you. How can systems better honor families when they first come in contact?
And thank you. There's a saying, if you're gonna don't discuss the community without the community being present. So let's take it one step further. Don't design programs for the community without the community co-designing the program that they will utilize for the services that they need. That should be the norm, not the exception. We have a really great example in Los Angeles County that I co-designed, which is called the Mother Board, which is a 21 African-American woman led advisory council of individuals who have lived experience as it relates to the maternal and infant health challenges. And so here's some good points for those who are in the room that might have the ability to do this. One, we treat everyone with lived experience as if there's someone who has a PhD. Your lived experience is just as credible and as valuable as someone with a degree, okay? So that's one. Two is they are paid like a consultant for their contribution to the work. They don't get $100, they get $9,000 for the year of work. $9,000. They're not overworked, they're not recognized, they're valued and centered with their lived experience. And that they co-design the policies and the programs and the efforts that county agencies such as Department of Public Health, Department of Human Services, and other departments will utilize to engage the Black community in the AIM prevention work. If you want programs to be used by the community you're serving, they should be co-designing the program. What that does is also build credible messengers, right? Because now they've had a hand in designing the very things they're going to utilize, and they're going to go back to their communities and their neighborhoods, and they're going to tell people about it. And that will then increase the utilization of that program. The next thing I would say, or the next really big point is, we got to do away with the savior complex. Okay, you're not saving nobody. We have to understand that the system was created, okay, to cause harm. And if you work for the system, don't take it personal. Don't take it personal. You need to humble yourself and come before the family as a co-creator, a co-designer, a supporter, and empowerment. It's about them and not you. Yes, we're here to look at the safety issues, but I love how you said, Andrea, you said What does the mom or dad or grandma who's ever taking care of the kids, what is the gap in their needs that needs to be addressed so that they can show up powerfully for that child? This even goes back to Maslow's hierarchy of needs. When people are lacking food, housing, shelter, those things, no one can think about the self-actualization that we all really want for our children. I don't know, I grew up in deep poverty where I only ate once a day. To this day, as a 40-something-year-old woman who has the means to eat, I still struggle to remind myself that I can eat more than once a day. That's that generational stuff that we're dealing with. And to assume that people, just because they're adults, they should have it together is not the case. So humble yourself. You're not the savior. Design stuff with the people you want to. And I loved in the comment section is on fire. Someone said research the community. I'm going to take it one step further. So that Empower Them Collective, we do community-based participatory research, which means the community studies itself. We don't allow people into our community like we're lab rats to be studied. We provide training and capacity building skills to the community so that the community can study its own challenges and then work together to identify the solutions they need. And then through our leadership training, they know how to come and sit at the table and make their requests known. Demand, quite honestly, I'm going to be nice, demand that their needs are met. So those are just some of my recommendations of how you truly, authentically, equitably, shared power, in good faith, engage the community to ensure their needs are met.
Thank you, Tavia. I am a firm follower of Maslow's hierarchy of needs. And I show up in my career for the last 20 something years, sometimes feeling like I have this imposter syndrome because I have all of this mistrust for the system through my experience. But then in working for the system, I have learned to understand why it is the way it is and it's built the way it is. And so I just appreciate you saying, bring them to the table, listen to them at the table, let them help fill the table, and then guide them a little bit as needed. Right. And so I totally hear what you're saying and I appreciate your voice. Um, Question 4. What message do you want leaders, staff, and partners in this room to carry forward? And this time we're going to start with Tavia.
Oh, now more than ever, with everything that's going on in the world, funding, money, budget, let's just go there for a moment. You need the community's help to help the community address its own needs. So the more we can provide capacity building to the community members and families who are ready for that, okay? Because there's families that are in crisis, and right now we need to address those needs, right? So when people move past that and they're ready to be a part of the change, we need to provide resources for the families that are ready to support other families and to help engage with systems. So for the leaders in the room, start to invest in bringing families, parents who've made it out successfully, whether it took a year, 2, 3 years, whatever the case may be, so that they can be those peers that can now work with the other families and value them at a high level. Please don't tokenize them. We need to dig deep because the only way we're going to sustain and survive and then eventually thrive is by empowering the community, the families, to actually support the work by doing the work themselves. So that would be my recommendation.
Thank you for that. Help us, help you, help us is what I just heard you say, right? Help us, help you, help us. And it's going in a cycle. We're all saying the same thing, right? But it's not what you do, it's how you do it. It's not what you say, it's how you say it. And so I feel like that was pretty powerful. Tencha, what message do you want leaders, staff, and partners in this room to carry forward?
Okay, I'm thinking about it from the sense I'm taking myself back to 2009 when I first was introduced to the system. What would I have wanted them to help me? I mean, what would I say to them back then? I read a comment in there about, some workers out there that are actually doing the work, and that is absolutely true. Working with LA County, I had an amazing social worker that did her due diligence to help me get back my daughters because of the story that I had with San Bernardino County. So that's why I bring up 2009. What I want you all to take away from this is that we are individual peoples. We need some, and I read in the comments as well, like sometimes we don't know, like we don't know. I didn't know that there were systems out there. I didn't know that there was help out there. I did not know. When I was heavily into my addiction, when I was, being beat by my ex-husband, and I had no one to turn to, and and I had family there, but I was so embarrassed because of what was going on. I couldn't say that I needed help. I think that there needs to be more talk about these things, and let's not pretend that it's not happening, because it's happening in many households. I'm pretty sure it's happening in affluent neighborhoods as well. But let's be honest and let's talk about these things. Let's bring up these things and let people know, hey, you're going through it, but it's okay. We're here to help. And if you don't know how to help, like Tavia said, get with people that know about these things. Ask them what could have made a difference in your life. What could we have done? Like I said, I had no idea that there were self-help programs like Narcotics Anonymous, or I had no idea until I got into the system. And so these things should be talked about way before that. Let it be known instead of, I don't know. I feel like sometimes we try to brush it under the rug because we're embarrassed about these things that we have for our communities. But like they said, these are systems that were put into place to keep us down. That's what I feel like. And then sometimes some of us rise out of the ashes and we start to move forward. So, like with the things that I want to do with school, I do want to create systems change. I do want to address the Relocation Act, the Kill the Indian, Save the Man, and all these different things that have hurt my people intentionally. So these are things that I feel like, let's talk about these things. Let's make people feel like they're not I'm going to keep saying this over and over. Just make us feel like we're not a burden and that you're really here to help. And if you don't know how to help, be intentional with it and say, how can we help you? Thank you.
I love that because I don't think not one employee in the state of California comes to work to say, I'm not helping these people today, or how can I ruin these people's lives even more, right? They come to work with their hearts. They come to work with their minds open. We really, really try to meet people where they are, but we also don't have maybe the same experience or maybe the same cultural upbringing. And so I love what you just said, right? If you're not sure, just ask me. I'm an open book. Obviously, I'm here. I'm an open book. Talk to me. That's how we build trust. I work the linkages program in the state of California, and our main philosophy is remove the silos, build collaboration, and communicate. And that's all the families are needing and wanting. And that's the exact same thing that our agencies want to do. So, how do we get that together? How do we meet each other in the middle? Um, is huge, right? And that's why we're here today at the table having this great conversation. Um, Tiffany, what message do you want leaders, staff, and partners in the room to carry forward?
The message I would like them to walk away with is that when they first meet a family, I know that like we've done bad to get us in that situation, but they need to have hope and encouragement and support that we can reunify with our children. We can build our family stronger. I hope that they'll be able to provide Native American resources, more Native American resources for Native American families. And maybe they should have, like Tencha said, like a family to family support group also, where people with lived experiences that were unified with their children could encourage the people who are just getting into the system and saying, hey, you can do it if you follow the guidelines, and there are resources out there. And also too, I wish that there was more supportive financial resources for people who, like for me, I had to quit my job to care for my mom who has cancer, but because my children are receiving SSDI benefits, I'm like, the government's only giving me $450 for food stamps, and that's supposed to feed my family. And also too, like, I can't collect child support because the child's father doesn't work. So, there should be more resources for single parents so that we don't fall back into the system. We're able to continue to strive. Thank you.
Thank you, Tiffany. I hear you saying uplift identification from the very beginning, right? Who are we and how and learn how to approach us based off of that identification so that way you get Native American services and resources if that's what you should be eligible to. I hear you saying family, peer-to-peer support. Someone who has been through this process already has possibly really been successful through this process and can translate between, right? Because we're all speaking a different language. I hear you saying, show your hand. What resources do you have? Don't just offer me the resources that you think I'm going to benefit from, but what all resources do you have? Because I'll mess around and need a couple of more on your list that we didn't talk about, right? And those are the things that I hear you saying. So I thank you for your voice. Again, workers, we come to work every day with those thoughts in mind, and time flies, right? We really appreciate the feedback that you guys have provided with us today. And I believe we have time for our final question, and we'll start with Tiffany. How do we ensure prevention efforts are culturally responsive and grounded in community wisdom?
So, how can we ensure that they're grounded? You need to attend the programs that the cultural resources provide. Like I attended, I think it was Circle of Wellness that helped through OVCDC, which is Owen Valley Career Development Center. And they really helped me to ground myself, find out the emotions that I'm experiencing, help me to become a better parent with my children. They had, what's it called? Youth employment, where one of my children was old enough to participate, and they offered services of helping them find jobs. They also, both my boys were able to attend the Dreamers Resource Fair at Universities of San Bernardino. And just, participating in the cultural events that are offered. And also too, they offer, like someone had said in the chat, there's tribal TANF where they help you financially, and they help you with your schooling. There's lots of services that they do offer us Native Americans that I'm grateful for.
When we become employed, we're so excited to have the job, right? We went to school, we got our degree, we applied, we went through the interview process, and now we're at work. Yay. And that doesn't mean that we're aware of all the resources that the community offers, right? If I've never dealt with a Native American family, I have no clue as to what resources are available to the Native American community. If this is my first time having an interaction with an African American family, I have no clue or understanding what resources are available out there for you. And over time, we begin to learn. Over time, we began to notice and say, oh, one of my families told me about this. Maybe you can check this out. And eventually, our coffers fill. And eventually, we learn about those resources. Coworkers may hear us on the phone with someone and say, oh my goodness, I got a resource for you. Let me tell you. And that's kind of how we build our resources. And so, plus what we have lists and lists that we have booklets full of resources that we're not memorizing. We don't really utilize them until we utilize them. And so, what I hear you saying is understand what's out there. Find out, figure it out, do a Google search, and meet me where I am with my needs, is what I hear you saying. Tavia, how do we ensure prevention efforts are culturally responsive and grounded in community wisdom?
Thank you. I think every question I've answered has been rooted in not for us, without us, right? But I think my final thought on that would be um, we need to close the feedback loop to the entities that are creating these prevention services. So, for lack of a better terminology, I would say advisory councils, right? So then that way, these institutions can go speak directly to the trusted community people to say, yeah, this works, this isn't working, this isn't culturally aligned, this is going to be a challenge. So I think, again, not being the exception, but the norm, that there is a advisory body, a third party body that I don't want to use the word holding these providers accountable, but to an extent as like a watchdog. Like, hey, we're looking and we're checking to see if this is continuing to stay in line. So that would really be my recommendation, that there is a third party entity, the community, that is in partnership, communication, and closes the feedback loop with these entities to ensure that they remain aligned with the goals and the intentions that were set when these prevention services were designed. And that these institutions are open to the feedback and will be quick to make adjustments to ensure that the community feels comfortable interacting and engaging with them.
Thank you for that. I feel like that was kind of like a little bit of what you had previously said about what did I do with my notes? Bring them to the table, listen to them, take that feedback in, and make changes. One of my previous directors told me plan, study, do, act, right? Plan, study, do it, and then repeat until you feel like you've gotten it together. So I appreciate that. Tencha, how do we ensure prevention efforts are culturally responsive and grounded in community wisdom?
There's a few points I want to make. First one I want to really address is tribal sovereignty. Understanding that every tribe has their own sovereignty and understanding what that means, right? A lot of us are here. A lot of us here are not California tribes in urban areas, but there are tribes here. California is home to one of the most populated tribes in all of North America. So understanding that every tribe has their own sovereignty and how to work with them and not tell them how to run their systems. But when working with urban natives, working with nonprofit native organizations that work directly with tribal members who are not from here and learning the needs, right? There's an intersectionality with our people that a lot of us have the same traditions, a lot. There's similarities, but they're not the same, right? So understanding that part. Also, and I heard that word earlier, tokenize. Don't tokenize us. Don't do a land acknowledgement and thinking like, oh, check off, Actually intentionally working with our community and working with these nonprofits because they'll know what we need. A lot of these nonprofits here, I know a few in LA that have actually done a lot of data work on what's working for us. For myself, it's coming back to my tribal ways, my traditional ways, learning about the language, learning about the culture, practicing my language in every time that I can. So when I have a little grandbaby now, I talk to her in Navajo with the words that I know, right? Just learning the little things, right? Because culture and traditions for me is super important. When I go and I go to my own tribe and I see the different things that we do, it's beautiful. I go to the Southern Ute tribe, beautiful. I go to different tribes out here. It's just so beautiful. And those are the things that we need for us as people. Now, again, it's learning to co-create also with other organizations, again, to learn how to lead on what we need. Um, Tribal sovereignty, I kind of lost my thought, you guys. I'm sorry. Um, Building trust. I'm sorry, I lost my thought. I was on fire and then I lost it. But anyways, the point I'm trying to make is just don't try not to act like you know what we need. Ask organizations or ask tribal members directly, but understanding that these are our own opinions that we're working with. I can't speak for all tribal members. I can only speak for what worked for me. This is never going to be a one size fits all. It's not a cookie cutter process. Everyone's going to have different needs, but just meeting us where we're at. Thank you.
I don't even think that I need to reiterate anything that you just said. I think your point was clear and came across perfectly. So I thank you for that. I want to thank you all for being a part of today's engaging discussion. Rooted in community, parents leading trust and protections for children. Your insights have illuminated the many ways collaboration can catalyze meaningful change and strengthen prevention strategies across communities. Throughout this session, we've explored diverse perspectives. Panelists have highlighted both the challenges and opportunities inherent to translating collaboration into tangible outcomes. A reminder that effective prevention requires both vision and coordinated action. I want to sincerely thank each of our panelists, Tencha, Tavia, and Tiffany. Your thoughtful contributions, real world examples, and candid reflections have provided a rich foundation for everyone here to consider and act upon. As we conclude, I invite everyone, both panelists and audience members, to reflect on how today's discussions inform your work. How might you apply new strategies, forge stronger partnerships, or foster innovation in your own communities? Prevention is most powerful when it moves from dialogue into action. Although our formal discussion ends here, the conversation doesn't have to. I encourage you to connect with our panelists, encourage these discussions in our networks, and share learnings that can extend the impact of today's session. Thank you once again for your time, expertise, and engagement. Let's move forward, inspired to transform collaboration into meaningful, lasting prevention outcomes. Thank you.
Wow. Whew. Y'all, I mean, can we just take a moment and I see all the emojis. Please keep them coming. We need a collective just inhale and exhale. Both of these panels, both of our panels, y'all. Wow. Please see the love and the joy. Oh, my heart. I'm fired. Tencha, I'm with you. We fired up. Yes.
Girl, I'm
Oh,
gonna say, let's go. Let's just do this. Like, let's get this done. Together we can, right? Together we can. And
together we
if we just
can.
if we keep on just like pulling each other down because it's a system that was built to do that, right? They want us to, like fight for scraps. No, if we can go do all these things out there in this world, especially California, we can take care of the whole nation. We need to be able to take care of in-house first. That's what we need to do. And for those who are down with it, we need to start creating policies that are aimed to help our communities because we have so much trauma. All most
Yes.
BIPOC, I would say BIPOC communities, period. We have so much trauma, and people could learn from us and how to do these things. But I get the feeling that and not to disrespect. I mean, maybe I do want to disrespect government systems. I don't know, but maybe they want to do that because they're afraid that they're going to lose a job or something. But instead of looking at it like that, look at it like a different way. Maybe we'll create better jobs that will keep people together, keep people housed. We're creating different things, right? Those are my
Mhm.
thoughts.
Thank you, Tencha. No, I listen, every single thing. I saw all the comments. I see how both panels are doing exactly what they're supposed to, right? We're reacting in real time, we're processing in real time, we're receiving in real time. So much of the discussion in the chat is just illuminating that. And that's exactly why we're here.